My name is Rose James. I am the Public Health Associate Officer with the Urban Indian Health Institute. We're part of the Seattle Indian Health Board. And I have been working with Grub and Feed 7 Generations and Swinomish and our partners in Portland at Oregon State University for a long time around the work that they do with food sovereignty and building this curriculum and train the trainers that helps our communities learn to recapture, learn to take back our culture and our community foods that have kept us healthy for generations. We have a high rate of diabetes, obesity in our communities, heart disease, many other kinds of chronic and other conditions that we never had in previous generations when we were of the knowledge of how to collect, how to harvest, how to prepare, how to produce and to consume our traditional foods and utilize our medicines. And a lot of that knowledge has not been handed down, or at least not been handed down to a number of the people in your younger generations and my generation as well. So we're pulling together pieces of that knowledge with this curriculum, with the communities that we're working with. And as these communities adapt that information and that knowledge and that curriculum to their own cultures and their own habitats and resources, that becomes part of their community as well. I'm responsible for overseeing how we track and monitor the activity of this project and the train the trainers and how it's being used in the communities. So from a public health perspective, we often are looking at things that spread in through our communities and in our communities that are negative, like disease and conditions. In this particular project, in this case, what we are seeing through our measurement and our mapping and our engagement with the community is the spread of something that's healthy and culturally grounded. And we're seeing it be picked up by many different communities and adapted to their culture. And that, to me, is also an element of public health that we are not always tracking, we're not always paying attention to. How do we actually reclaim our wellness? How do we reclaim our cultural cuisines and bounties and teach our children how to do the same? The results that we've been finding have shown that as the curriculum is being taught in our different tribes and urban Indian organization communities, that it's being picked up and shared with other communities, other parts of the population, maybe, with youth for one event or training and with elders for another. We've also found through our evaluation and data collection that it's being used in ways perhaps we weren't always expecting. Maybe people aren't always adapting or adopting whole meals with traditional foods. Maybe they're taking little pieces of it at a time, but they're also going out and harvesting, which takes a lot of physical activity. They're doing things that are healthy, and they're doing it in a way that they are engaging other parts of their family and communities in that activity. My overarching vision for this project and my role in it is that we make visible that we can reclaim our cultural center, and our food is at that center. Our food is our medicine. And by reclaiming that, we can also show that Native people are the knowledge keepers that can improve the health and wellness of our people in generations to come, that we can do it ourselves. This particular work has, it's close to my heart because I've actually witnessed family and friends make changes in their lives in ways that going to the doctor and hearing that you needed to see a dietitian didn't really um, allow them to change how they approached their foods. But when you wrap it in a cultural blanket, it it really takes on that whole community and it builds that community around you. And you start to also identify yourself within that knowledge and those foods because those are the same salmon berries that our ancestors picked and prepared.